One of the things I'd like your listening or viewing audience to know is that one of the hardest parts for me and the team that I work with is when patients come to hospice services late in the course of their illness, in the last few days or in the last week or
That must
even
be
the last
tough.
month. And the average length of stay on hospice is less than a month, the median.
Wow.
And that means all those months preceding that time that we could have been there and we could have
Right.
made visits, volunteers could have come by and read to them
Sure.
or taken them to the grocery store
Right.
or taken the dog for a walk and the
You
social
even
workers.
do that?
Yeah, we'll do
Oh
anything.
my goodness.
We are the only specialty in all of medicine where volunteers are required to be part of the care team, and they sit at the table and have an equal voice at the table, and in the care of the patient, and they may be the most important person on the whole team. My role is to handle the medical issues
Right.
and make sure that their symptoms are under control.
Right.
And to get in there and deal with the other physicians on the other end of the.
That must be difficult. Is it? You know,
It can be.
because they don't have that feeling that you do.
Well, I think it's more of an issue that they may have cared for that patient for a long time and developed a close relationship, and there's a genuine fear that they are going to be relinquishing the care of the patient who means so much to them
Okay.
to someone they don't know.
Right.
But that's not going to happen. As closely as they want to be involved, we'll involve them.
They can be involved.
And we want to collaborate with the referring physicians in the care of their patients.
Sure, because you learn more.
And they have their area of expertise.
Right.
It may be an oncologist, it may be a neurologist, it
Sure.
may be an internist, and they know how to care very well for the types of problems they see in a given patient. And I know how to care for the symptoms of advanced illness.
Right.
And it may be very unfamiliar to a typical practicing physician,
Right.
how to handle very high dose medications that a patient may need. But that's my area of expertise.